A breast cancer diagnosis strikes fear into the hearts of most people, throwing their lives into chaos, impacting their families, and putting immeasurable strain on the relationships they need to rely on most.
I thought that I was winning, and then you think you've lost the fight. And in my head, I think, how could I get back from that?
Cancer sounds like a sentence to the people hearing it for the first time. Calming their fears and getting them ready to undergo treatment is essential. It's a challenging task that leaves many people physically and emotionally drained. Breast cancer is the most common cause of cancer in women. This year, it's estimated 17,500 women in Australia will be diagnosed with breast cancer, 2/3 of whom will be between 40 and 70 years old. In men, it's estimated that 144 patients will be diagnosed this year. The Breast Cancer Research Centre of WA is conducting groundbreaking clinical trials for the care and treatment of patients diagnosed with breast cancer.
Since 2000, at Breast Cancer Research Centre WA, we have been involved in over 80 international, national and local trials. At least 12 of those trials have enhanced breast cancer treatment worldwide. We're highly accountable, have excellent governance systems, a really strong board, and donations go completely to patient support and treatment. We're currently a significant player in the research space, being Australia's busiest breast cancer trials unit. We see approximately 12 new breast cancer patients a week, and our aim is to have support services whereby we provide a one-stop shop to patients.
Principal investigator in worldwide breast cancer research is medical oncologist Professor Arlene Chan. She's a key player, collaborating with breast cancer experts worldwide to bring new treatment opportunities to patients, and has been a dedicated breast cancer specialist since 1998.
In my career, I've had the privilege of caring for more than 4,000 patients with early and advanced breast cancer. The majority of patients with early breast cancer have been cured as a result of receipt of treatment, as a result of clinical research. And importantly, many of the patients with metastatic disease that I've had the privilege to care for have survived their illness for many years, and a small handful have actually been cured of their metastatic disease because of the treatment that they've received as a result of clinical research. I think in many instances, people living in Western Australia, or indeed in Australia, believe that they need to travel overseas to be able to receive the best standard of care for breast cancer. And I would suggest to you that that's not the case. Certainly in Western Australia, I believe that it is possible for women and men and their families to receive the best possible treatment for breast cancer, be offered entry into clinical research, and thus receive the best possible treatment. And certainly one of my passions is the development of a comprehensive breast cancer centre that we hope to open here shortly, where women and men diagnosed with breast cancer, as well as their families, will be able to receive the best possible treatment, which is going to result in the best possible outcome for their condition.
For Professor Arlene Chan's patients, she's more than a doctor, more than a friend even. For many, she's the only reason they're still alive.
I am in awe of many of the women and men in terms of the courage that they have in going through the treatments with the side effects that are involved, but more importantly, long-term, beyond the diagnosis, having to face the risk of the cancer recurring, or indeed that if they have metastatic disease, that their lifespan may be shortened by the illness. And therefore, knowing these individuals and knowing them as people gives me the inspiration that I need to be able to do the best job that I can in caring for them. And in part of that, that is the reason why it drives me to do the research that I do. Because as a result of the research, I am confident that I'm going to be able to provide them the best world standard of care, and ultimately that will translate into better outcomes and survival for these women and men diagnosed with breast cancer.
Breast Cancer Research Centre of WA is reshaping the future of breast cancer care by launching a $5.8 million campaign to fund a one-stop shop, a centre which will offer multidisciplinary care to women and men affected by breast cancer.
We are asking for your help in developing an integrated, comprehensive breast cancer centre for treatment, support and research right here in Western Australia. Your generosity will help us improve the lives of breast cancer patients for now and for generations to come.
My greatest fear is my children having to go through the same disease, and I'm not going to be here to support them. So for me personally, if this centre was up and running, I know that they would have the support, they would have the research, and they would have the care for them to be able to be looked after.